World Diabetes Day is this Friday. It's an annual global awareness campaign held every year and is the world's largest diabetes awareness initiative. The day aims to raise awareness of the impact of diabetes on health, promote opportunities for prevention, diagnosis, and treatment, and to advocate for improved access to care and support for people with diabetes. According to the El Paso Center for Diabetes, an estimated 15.3% of El Paso County residents have diabetes compared to the national average of 11.6% in the United States. And joining us now is Dr. Juan Castillo, an endocrinologist at University Medical Center of El Paso, who specializes in treating diabetes. Dr. Castillo, thank you so much for joining us. What are some of the contributing factors to El Paso being so far above the national average when it comes to diabetes diagnoses?
Well, thank you for having me. That's an interesting question. Definitely there's a genetic component in the development of diabetes mellitus, especially type 2. Latin American populations, people of Caribbean descent, African Americans, Native Americans have more predisposition for developing diabetes mellitus, especially type 2. And on top of that, you add our diet. And I say our diet, I'm not from El Paso originally, but for where I come from, we have the same problem. I'm from the Caribbean, and our food is a contributing factor of developing diabetes.
What would you say in terms of the causes of diabetes? You just mentioned a couple though, but what is most prevalent? I think most of us assume what you just said. It has to do with our diet, eating foods with too much sugar in them. Does it have more to do with some of those lifestyle choices, or does genetics, does that play a larger role in some of those numbers?
Well, we have both, right? We have the genetic predisposition, and on top of that, the fact that you have the genetic predisposition doesn't tell you that you're going to be diabetic right away, right? But if you add the environmental factors, definitely it will push you. Lifestyle has a lot to do, and I can tell you in my experience, in my practice, I've seen patients changing for the better in their diabetic management. They get better numbers, right? Reduced risk of complication when they adhere to an appropriate diet, a diabetic-oriented diet, and they change their physical activity, their lifestyle, right? So it is a heavy, heavy component what we eat and what we do regarding diabetes. And those are the main factors.
Part of the reason World Diabetes Day is so important is to get people to start doing blood work, getting tested, that is. How dangerous is it for someone who has gone undiagnosed with diabetes? And with that, what are some of the signs and symptoms people should be most aware of that kind of point to diabetes?
It's difficult because, as you say, like right now out there are people walking around being diabetic and they don't know about it, right? If they don't have some regular checkups with their primary care physicians, with their doctors, they wouldn't know. And years may go by and they have no idea they have diabetes. Unless blood sugar in your blood gets too high past certain number, certain point, people notice, they say, oh yeah, I've been peeing a lot. I've been having increased urination, like I have to wake up at night multiple times to pee. And that is the most common sign that people notice, that we can tell. But to be sure, you need to be checked. You have to have, at least as an adult, a yearly check of your blood sugar levels.
And when someone is diagnosed with diabetes, what's a common plan of action? How is it treated? And just how significant are some of those lifestyle changes?
As I said, lifestyle changes is the first step. When they get to our office, depending the degree, how deep they are in diabetes, you know, how their hemoglobin A1C, how high it is. Sometimes I choose to treat my patients, you know, with diabetic education classes. You know, we get them together with a dietitian, right? We have clinical pharmacists that also help them with their diet, and we see. And sometimes just making those small changes make all the difference. Of course, if they are if they have higher levels, if their diabetes is uncontrolled, we need to go, directly to the heavy guns. We may need to use insulin to control the numbers, because leaving them with blood sugar levels high, I'm telling you, numbers above 200, 250, 300. I have patients that they've been walking around with levels about 450, and that's terrible, because it damages your organs, especially your eyes, your kidneys, right? Diabetes is the leading cause of blindness in this country. Diabetes is one of the leading causes of renal failure, that people, they need to get connected to dialysis, right? It's the main cause, the leading cause of amputations. So you have to do something, and you cannot let those patients walk around with uncontrolled blood glucose levels. And we have to use sometimes insulin in those patients.
Real quick, Dr. Castillo, the holidays are coming up, and there's a lot of people out there, including myself, probably have already gone through a couple bags of Halloween candy. The pecan pie is next. Don't even get me started on the Christmas cookies. People want to indulge this time of the year.
Yes.
Is that still possible to do without putting yourself at a greater risk for diabetes?
Of course you can. Of course. I tell my patients, the holidays are special occasions for you to be with your family and to enjoy, right? It's a good thing that it doesn't happen all year. It happens only once a year. If you meet with your family and you guys are eating, go and eat with your family. That's the important thing. But if you're diabetic, you have to watch out and be a little bit careful, right? If you're not diabetic, you can go ahead and indulge yourself. But diabetics, they need to be just a little extra careful. Of course, we have the rest of the year to take care of those numbers, right? But family first, always.
Family first. Dr. Castillo, thank you so much for your insight on a topic that affects a lot of El Pasoans. We certainly appreciate your time with us.
It's my pleasure. Thank you for having me.
All right, that is Dr. Juan Castillo, an endocrinologist at University Medical Center of El Paso.